Welcome to Psychology and Physical Training channel. Have you ever wondered why evaluation is so crucial in counseling? Well, imagine you're on a journey with no map, no compass. That's what counseling can feel like without proper evaluation. Now we see the importance of evaluation in counseling. Evaluation in counseling plays an indispensable role. It's the compass that helps us steer the course of therapy, providing direction and purpose. Without it, counseling can become a process of guesswork and assumptions, which can lead to ineffective treatment and, in the worst case, harm to the client. But as with many things in life, evaluation in counseling is not without its challenges. One of the main problems we face is bias. Bias can creep in unnoticed, subtly influencing our judgment and interpretation. It can stem from the counselor's personal beliefs or experiences, or even from the client's self-perception. It's a tricky thing to manage, but acknowledging its existence is the first step to mitigating its effects. Inconsistency is another major hurdle. Different counselors might evaluate the same client differently, making it hard to compare and contrast results. This inconsistency can be due to variations in training, theoretical orientation, or even personal style. It's essential to strive for consistency to ensure that evaluation results are reliable and meaningful. Then there's the problem of lack of standardization. Without a standard set of criteria or procedures, evaluations can become subjective and variable. This lack of standardization can lead to misinterpretation of results and misdirection of treatment. Hence, it's crucial to establish and adhere to standardized evaluation methods. So you see, evaluation in counseling is not just important, it's vital. It's the lighthouse that guides us through the complex and sometimes murky waters of human emotion and behavior. It helps us understand our clients better, tailor our interventions to their unique needs, and track their progress over time. It's the tool that allows us to provide the best possible care to those who seek our help. Without proper evaluation, counseling can be like navigating uncharted waters. But with it, we can chart a course to healing and growth, steer clear of obstacles, and find the most effective route to our destination. So let's delve deeper into the world of counseling evaluation and learn how to navigate these waters with confidence and skill. Now, let's dive into the different approaches to evaluations in counseling. One of the most commonly employed methods is self-reporting. This involves clients providing their own account of their thoughts, feelings, and behaviors. It's like having a conversation with oneself, but in a structured and analytical way. The beauty of self-reporting is its directness. After all, who knows a person better than themselves? However, this approach is not without its flaws. There's the risk of bias, as well as the potential for clients to misinterpret or misrepresent their own experiences. Next, let's talk about the observation method. This is when counselors observe and record client behavior during sessions. It's a bit like being a detective, looking for clues and patterns in the client's behavior, words, and even silences. This method can unearth valuable insights, but like any good detective story, it's not without its twists and turns. The main challenge here lies in interpretation. What one counselor sees may not be what another sees, and this subjectivity can lead to differing evaluations. Last, but certainly not least, we have standardized testing. This approach utilizes psychometric tests to gauge various aspects of a client's mental health, from cognitive abilities to personality traits. The strength of this method lies in its objectivity and comparability. You're essentially comparing apples to apples. But, as the saying goes, not all apples are created equal. Standardized tests may not account for individual differences and can overlook the nuances of a person's experience. So, what's the verdict? Well, it's not as simple as choosing one approach over the others. Each has its own strengths and weaknesses. Self-reporting brings personal insight but risks bias. Observation can uncover hidden patterns but is subject to interpretation. Standardized testing provides objective data but may overlook individual nuances. As you can see, each approach has its own strengths and weaknesses, which is why a combination of methods is often used. And next topic is problem of measuring change. Measuring change can be a complex process. How do we accurately track progress in counseling? So let's dive into the intricacies of this issue. One of the primary challenges we face is the timing of assessments. Imagine a counselor who measures progress after each session. The client may be in a different emotional state each time, possibly skewing results. So when should we measure change? Next, let's consider the variability in responses. Two clients may experience the same level of improvement, but express it differently. How do we account for this variability? Lastly, we can't overlook the subjective nature of self-reports. Clients may underreport or overreport changes due to a myriad of factors including perceptions, emotions, or even the desire to please the counselor. This is a hurdle we must always be aware of. Clearly, measuring change is not a simple task, but a necessary one in the field of counseling. Now let's see criteria for evaluation. What criteria do we use when evaluating counseling effectiveness? That's a question that can make or break the success of any therapeutic intervention. First, one of the key criteria is goal attainment. This means assessing whether the client has achieved the goals set at the beginning of the counseling process. These could range from overcoming a phobia, improving interpersonal relationships, or managing stress better. It's crucial these goals are SMART, that's specific, measurable, achievable, relevant, and time-bound. Secondly, symptom reduction is another vital yardstick. This involves monitoring the decrease in the severity and frequency of the client's symptoms. For instance, let's take someone suffering from anxiety. A successful counseling process would ideally lead to a reduction in anxiety attacks, or even their complete disappearance. The third criteria is improved functioning. This pertains to enhancing the client's ability to handle daily life activities and improve their overall quality of life. This could mean a client being able to return to work after a period of mental health-related absence, or a student being able to concentrate better in class. Setting clear, measurable goals is critical in these evaluations. It's like having a roadmap. It guides the therapeutic process and provides a clear direction. It's important to remember, however, that these goals should be flexible to accommodate the changing needs and circumstances of the client. Using clear criteria for evaluation ensures that we can track progress effectively and make necessary adjustments in treatment. And next topic, we learn about control of extraneous variance. How do we control for extraneous variance in counseling evaluations? This is a question that often pops up in the realm of psychological research. But what exactly is extraneous variance? Simply put, it's the variation in participants' scores that doesn't result from the variables we're interested in. It's the noise, the static, the clutter that clouds our data. Now, controlling this variance is crucial because it ensures our results aren't skewed by these uncontrolled, potentially confounding factors. So how do we go about doing this? One common strategy is randomization. By randomly assigning participants to different conditions, we can help ensure that any differences in outcomes aren't due to some unobserved characteristic of the participants themselves. Another strategy is the use of control groups. These are groups that receive no treatment or a placebo treatment. Comparing results between a control group and an experimental group can help us tease apart the effects of the treatment from other factors. We also have statistical adjustments. These are mathematical techniques that help us account for the influence of extraneous variables. This could be something like controlling for age or socioeconomic status in our analyses. But remember, while these strategies can help, they're not foolproof. There will always be some level of variance that we can't account for. That's why it's so important to be cautious and critical when interpreting our results. Controlling for extraneous variance is key to ensuring that our evaluations are accurate and reliable. And now we learn about counseling effectiveness in educational settings. Let's examine some studies on counseling effectiveness in educational settings. Research has continuously highlighted the significant impact of counseling in schools and universities. For instance, a study conducted by the American School Counselor Association showed that students who received counseling services had improved academic performance and better behavior compared to those who did not. In another study by the National Association for College Admission Counseling, it was found that students who participated in university counseling services had higher retention rates and overall satisfaction with their college experience. These findings are important because they demonstrate that counseling can enhance not only academic success, but also the overall student experience. Now, the importance of ongoing evaluation in these settings cannot be overstated. Regular evaluation allows educators and counselors to monitor the progress of students, identify areas that need improvement, and adjust counseling strategies as needed. It's all about creating an environment that's conducive to learning and personal growth. A study published in the Journal of Counseling Psychology underscored this point. The study tracked the progress of students who received counseling services over a 5-year period. The results showed that students who received regular counseling and timely evaluations had improved mental health, better academic performance, and higher graduation rates. These studies are just a few examples of the positive impact counseling can have in educational settings. But remember, these results are not automatic. They are the fruit of diligent work, thoughtful strategies, and most importantly, effective evaluation. Without proper evaluation, it's like navigating through an ocean without a compass. You might make progress, but it's hard to know if you're moving in the right direction. These studies underscore the crucial role that evaluation plays in ensuring the effectiveness of counseling in educational settings. It's not just about providing counseling services, it's about evaluating these services, refining them, and ensuring they truly meet the needs of the students. This is how we transform lives one student at a time. And if you feel this video is helpful, do not forget to like, share and subscribe Psychology and Physical Training channel for more videos. Thank you.